as Maeve mentioned, she's the social and mental health technician teacher. And so the students are going to learn those technical skills and knowledge components for that industry. They're going to earn industry certifications and credentials. They're going to learn professional skills, or those employability skills that are vital in whatever career path they choose. And then a lot of our programs also offer dual enrollment college credits. And so I'm actually going to have you advance the slides kind of far. So if you want to go ahead and advance down to where it shows the different ways to engage with us. We'll just keep going. And then we'll stop there. So Maeve's class actually is at our newest campus, JTED at the Bridges. And that is a partnership with Tucson Unified School District. So it's a campus where we have a daytime high school. It's a comprehensive high school that students can attend during the day, graduate from that school. And what we've done is in that partnership, we have replaced those elective classes that you see at your typical high school with JTED classes. So the students are taking career and technical education for all of their elective credits, but they also have math, science, English, language, PE, all those graduation requirements. So it's a very special campus with that detail. And then in the evening, the daytime students go home and the evening becomes a JTED central campus, which means that students from all over our delivery area can now come and attend those career and technical education classes as well. And so we have 2 campuses in one, and it has been a very successful campus, and the slides that I skipped outline some of those successes, but you can go back and take a look at those. And we're also happy to have an extended session to review any of that with anyone who's interested. And then I'm going to hand the floor over to Maeve, and you can go ahead and advance, it looks like 4 slides. One more. There we go.
Awesome. Thank you, Ashley, for sharing about JTED in general. Ashley is super helpful and knows a lot more about JTED, has been with JTED a lot longer than I have. So here are some pictures of me with my students, and you can go ahead and advance the slide, please. Thank you. So the social and mental health technician program is brand new for this current school year. This is the first year that we're running the program, and I am the only one teaching it at this point. It is a 2-year program. So right now I actually have sophomores through seniors, but starting next year, it's going to be a little more structured, where year 1 is going to be juniors and year 2 is going to be seniors. So students do need to complete the full 2 years of the program in order for it to be considered completing the program and getting certified, as well as taking a test. So the social and mental health technician program is meant to prepare students for entry-level positions in the mental health field, and kind of provide them the foundational knowledge if they choose to pursue a college degree in psychology, social work, the mental health fields. So as I said before, at the end of the 2 years of the program, students will receive a certification that is applicable to the mental health field. And they'll actually also take a technical skills assessment, which is run by the state of Arizona and tests them on 9 different technical standards that I've been given to teach throughout the 2 years of the program. It is a 100-question multiple choice test. All right, if you can advance it, please. I see the question. This program is available at Innovation Tech. So I teach it during the day as well as in the evening. The schedule for next year has only been set for in the evening, but I do know that I will be teaching at least 1 class that'll be for first-year students and 1 class for my second years who are moving on. So it'll be available during the day and in the evening, yes. So this program is really an introduction to how to help people care for their mental health, right? This is something that has actually been misunderstood as a class to help students with their own mental health. And as much as I would love students to walk away with some skills to take care of themselves, it's very much putting them in a position to get ready to help other people take care of their mental health and enter the mental health field. So here are some of the things that we're going to go over throughout the year. Learning about the different career options. We're going to talk about interviewing techniques, documentation, the importance of a biopsychosocial model, brain anatomy. We talk about stigma, mental health promotion and awareness. And then I have a layout on the next slide, actually. In year one, we will be going over the different careers and places of work. We'll do brain anatomy, the history of psychology, what it means to be a mentally and socially healthy person. We'll go over problem solving skills and goal setting. We'll talk about things like SMART goals. We will also talk about stigma and the societal impact on mental health. We'll go over things like personal values, beliefs, cultural influences on mental health, different community resources, locally and nationally. And then some of the basic mental health improvement strategies I consider, like psychoeducation or mindfulness. And then at the end of the first year, I would really like to have the students certified in first aid and CPR. That's part of the standards. And then I'm looking into psychological first aid as a first year certification. But I'm going to talk about certifications in a few minutes. And then in year two, which we haven't started yet, we will be going over the various mental disorders and conditions from the DSM. We'll talk about suicide and self-harm, addiction, eating disorders, loss and grief, life stressors. We'll look at the differences between what a healthy relationship looks like and characteristics of an unhealthy relationship. Year two is much more advanced. So when I talk about mental health treatments, now we're going to be talking about like CBT, DBT, the differences in treatments with therapy versus medications, much more in depth on the various mental health treatments that we have. They will begin to learn therapeutic communication skills. So that's when we're going to start talking about what it means to be an active listener, how to paraphrase, and really just how to communicate with somebody who may be experiencing, a mental health crisis or something along those lines. And then, of course, we'll talk about ethics, because I want to make sure that anybody that we're sending into the field is working in an ethical way. And the certification that I would like them to get at the end of the whole program, at the end of the 2 years, is mental health first aid. So if you could please advance the slide. Thank you. I do have a couple barriers that have become a bit of a challenge that I'm working with. So I'm going to talk about those, and I'm going to talk about different ways that any community organization can help us. So when it comes to the certifications, part of the reason why we're restructuring the program with juniors and seniors is certifications and organizations that train in like mental health first aid specifically requires that students be 18 and up. They will only train adults. Were you going to add something, Ashley?
I was going to wait until you were finished.
Oh, okay. Thanks. So we're kind of restructuring that with the hope that at the end of senior year, they'd be finishing up the program, and hopefully everybody would be close to 18 or 18 and up so that we can get them certified in that. I'm also looking into various different certifications that I can do along the way, whether that's in first year or second year as a program completion certification, if there are other ones that you guys, community organizations, think are more beneficial than mental health first aid or could be taught or trained with students who are under the age of 18. Another challenge that I've seen with multiple job postings in some of the community organizations I've spoken to is that a lot of the entry-level job positions do require the employee to be 21 or older. So obviously we're having students graduate the program at 18, ready for an entry-level position, but not old enough yet for a few more years. And then the rest of these are ways that you guys as community organization members can help JTED and help our program. And I think that that is something that Ashley and I can both speak to. If there's anything you want to add, Ashley?
Yeah, so I would just say we have lots of different ways to engage. And if you want to advance the slide, regardless of our programming, and I think this one's animated, so if you want to just click through, sorry, there's a bunch of them, but we have business partners and community organizations that partner with us in so many different ways. It's always easier for us in terms of liability to have you come to us as like a guest speaker. Anytime we add in the component of the public, like clients, patients, and any of that, the liability increases. And in this area, as Maeve explained, the age has been a challenge for us. We've had some organizations reach out, and we're working on ways to still get the students those experiences. So if you're willing to chat with us and kind of throw some scenarios between your team and our team and see what we can do. We're really looking for that transition, that entry-level transition job that they can do when they're done with this program while they continue to get that training and or education that they need for those 21 plus jobs. And so, Maeve, I think you did a great job of explaining the barriers you're facing. So right now, if you are interested in talking to us and learning more about the program, our contact information, well, my contact information is going to come up. So you can reach out to me, and then I can get you connected to Maeve, and I can also answer any of the questions that your HR teams or your legal teams might have. That's where I come in to help with Maeve and getting these opportunities going.
Thank you both. I was just super excited to have you come because if you think back to the first summit that we had for the coalition, when we asked the coalition the priorities, one of the biggest things that we heard was the need to increase the number of mental health professionals going into the field. So in hearing about your program, it just seems like there could be a lot of opportunities, to collaborate and to help your students be able to go on and learn about different work opportunities that are available.
And thank you all for your time. We appreciate you having us.
There was one question in the chat that Ange asked. She was just wondering if this new program is in part an effort to provide many more mental health helping personnel for the community. And so how did this program come to be? Is that why? Because of the critical need, or?
So we at the Bridges location, the Innovation Tech High School and JTED partnership, we actually have another building going up that's going to focus on health and medical careers. And so social mental health technician was the first addition to the list of healthcare programs that we offer. And yes, it came about from all of our programs. If we add a new one, it comes about from the community industry needs. So we were hearing, we need this, we need this, we need this. And so we try to provide, and we have students a lot of students who are interested. But our job in career and technical ed is to get those realistic real world experiences. And so that's really the biggest barrier we're running into. Not so much that Maeve's a great teacher, she's teaching the students, but how do we get them, once they're done with us, into those work experiences?
Yeah, and as Ashley said, I do see Daniel's post here in the chat, and that's a great point. I was not aware you only needed the high school diploma or a GED for those crisis mobile teams, so I will definitely be looking into that. And Vico, I also saw the links that you sent, and I'll be looking into those too. Thank you so much. As Ashley said, I'm looking for anybody to come into the classroom just to speak about their experiences with what they do and make community organizations more well known. Anything that the students can learn from. Obviously, the things like internships or field trips do take a little more of an approval process. Still things that I would love to do, but even if you're just willing to come in and talk to my students, please feel free to reach out. Like Ashley said on the next slide, I actually also added my contact information on there so you can get both of our emails. If you wouldn't mind putting that up, please. Thank you.
Yeah, and I see lots of opportunities for collaboration. So we will definitely be following up with you guys to see how we might be able to support this new program and help to strengthen the field. So thank you both so much. Does anyone have any other questions for them? Okay. Let's move on. Yes, and we will send the PowerPoint so that you have a copy of that. Let's move on to the next member spotlight. Super excited to hear about Leslie Enway's work at the Pima County School Superintendent's Office. So Leslie, go ahead and take it away.
Good afternoon, everybody. I'm happy to be here and excited to present a little bit to you about specifically the Resilient Schools program within our department, but I do want to start with a little bit of a broader overview. So if you'll go ahead and move to the next slide. So just, I know some of you on here know me, some don't, but I'm certainly not going to read through all of this, but I started out as a teacher. So I started as a teacher in the classroom, and then I became a school psychologist. But always my focus has always been changing our systems to be more whole child, whole staff centered, healing spaces. And I'm certified in a million things as a trainer, but mostly I train on my own work is what I have been doing for probably the past 7 or 8 years. And I'm also a board member of Casa de los Niños. And I'm a work group member of the National Comprehensive Care Network, which is funded by U.S. Department of Ed. So I get to see a nice broad cross-section of things that are happening in our country and across our state that's going on. So I don't know, probably a lot of people are not that familiar with the program side of Pima County School Superintendent's Office is unique. It's unique not in just the state, it's unique in the country. So there are not many county superintendent's offices that actually have a program side. And so I didn't even realize that when I came to the superintendent's office. So this has been a learning curve for me, but it's pretty incredible that we actually fund this section of our of the Pima County School Superintendent's Office. The whole mission of this is that they promote educational excellence through leadership, service, and collaboration. And that's what they do. And all of these, each of these programs, and missing from this list is cycle breakers and also grants. We have a new grants partnership and services program. And so the whole mission is let's reach out to community agencies, let's reach out to our educators, let's support and mentor and collaborate. That's the entire mission of the programs. So my particular program, the vision of my program is to really help create these foundationally safe learning spaces for both our staff and for our students, because we know that felt sense of safety, that belonging and connection, that's when the learning is going to happen. That's when we're going to start retaining our teachers. And so it's really this broad umbrella under which all of these things fall. And there's the little house graphic there. So really, my department is kind of two-pronged. So one prong of that is professional development, and the other prong is consultation and collaboration. All of it kind of keeping that focus of the whole school, whole child, whole community, whole culture which was just recently added to that model. And then keeping these ideas of belonging, connection, and agency, safety, and voice in there. So under the professional development, I run ongoing statewide cohorts, learning cohorts, and community practices, and also one-time PD, which is a lot of like conference presentations, going out to schools and presenting. And then also I do customized training series for different agencies. Just did one for Arizona Department of Health Services. And then I consult and collaborate also with schools and districts, state and national agencies, and then community organizations. So it's those two prongs. On the next slide are just a few of some of the training and professional development opportunities that we offer. So I do offer all of the ACEs consortium models, mental health first aid, the neurosequential model of education, which is a for-pay program, but fantastic. And then over on the right-hand side are kind of some of the more customized ones that are both series of trainings and also one-time PDs. Some of these I have done as keynote addresses. Some of them I have done, I've presented to the state school board on some of these. Just various audiences around the state, and just with different districts and schools and audiences. And you can go to the next one. Part of this is this was the creation of a model that I did a couple years ago. And part of it this work stemmed from, okay, we've got to create, we need to start with this belonging and connection, regulation and relationships. But we have a lot of work being done in silos in our schools. So we've got, you know, SEL done over here, and we have PBIS done over here, restorative practices here, trauma responsive. So really looking at how can we streamline this, make it trauma responsive. We know we've got to start with that safety piece and then move up into relationships and then move into learning. And so how can we do that within an equitable framework and really simplify the work that our teachers are doing into a cohesive model. So we are just about to publish the workbook finally on this. So we have been working on this workbook that goes along with the full model. So this is just a really simplified graphic. You can scan that QR code on the code if you would like a little bit more information about this particular model. It is just included in some of the work and some of the presentations that I do as well. And you can go ahead and advance to the next slide. These are the different cohorts and communities of practice that currently run through my program. So I run one on trauma responsive, I run one on integrated resilience, one on adult resilience, train the trainer. And that's really a lot of leaders in the field from around the state, which has been a fantastic, really learning experience for me as well, because I have the leaders in our field who are doing this work kind of all come together in one space and be able to talk about what's happening in their, you know, I've had assistant superintendents and I've had behavioral health, and I've had a professor from the U of A. I've had people from the health department. So come together and talk about what's working, but it's people who work with adults. And then I have the sustaining resilience community of practice, and that's because people really wanted to stay in the cohorts and they didn't want to lose that sense of community. So we kept those going. So we have 4 that always are currently running. And this has been the reach of those cohorts. We've hit 49 districts in the state, 23 different cities, and 12 counties. And so certainly while the focus, and part of that was because this work did start at the Department of Education. And so there was more of a statewide focus. And now, you know, that I'm at Pima County, which is tomorrow is my 1-year anniversary at Pima County. So I'm officially here a year. It kind of has honed in. We've honed in a little bit. And this time we have a lot of, especially more charter schools in the cohorts, which is really nice to see this year. But we always get from across the state as well. And so it's nice to bring in the various perspectives. So we always get people from tribal nations, and we get people from urban and very rural and down at the border, and what's working here with this population. It's just nice to bounce the ideas off each other. And just wanted to put this resource out there. So the cohort work and the PRISM framework were both recently highlighted by the Institute for SEL, and were published on their website. So it's just kind of they made it into like a step-by-step, if you want a whole community approach to implementing meaningful social emotional skill development. Is really how I like to frame it. You can click on that, and it kind of I like the way they wrote it and did it in a step-by-step. We're going to be publishing a blog like that on the U.S. Department of Ed website very soon, something really similar. And next slide. So I am currently taking names for the fall 2024 learning the cohorts and the community of practice. So I've got a waiting list going. So if anyone's interested, I intentionally keep them very small. I do have a co-facilitator who's contracted through my department, and we keep them small just so that our groups are no bigger than 12 or 13 people, and so that it's a really intimate sharing space. So if you would like more on that, you can always email me. And Anne, you said, is this a new focus for Pima County to be working with communities across the state? There's been a little bit of shift with that since the change in leadership at the Department of Education. And so there's just been a little bit of shift in focus with that, in the same thing in our grants department and a couple other of our departments. Certainly, we're still trying to make Pima County our primary focus. But there has just been a little bit of an extension of that because people need a little bit of a hub for some, some resources. And so we have volunteered to be that hub for some of those resources. And next slide, and this is almost my last one. So we did do the 2023 Celebrating Resilience Summit last year. It was a wonderful success. And so we are repeating it again. We will be bringing back Dr. Adolph Brown, who is fabulous, amazing speaker. I just landed, if anyone's familiar with Soma Breath, the founder of Soma Breath, who's from Spain, will be joining us. I'm so unbelievably excited about that. So this is an unofficial save the date because none of this is open yet, but I will be looking for breakout speakers. So if anyone's interested in that, being a breakout speaker or being an exhibitor, we had a wonderful array of exhibitors last year. So I'll definitely be providing more information on that as well. And that is and that's my contact. So I would love to, if anyone is interested in collaborating in any way, happy always to do that. You can reach out and connect with me, and we can set up any type of collaborations that you would like. And yes, some of you were there, so it was wonderful having everyone there at the event.
Thank you, Leslie. This is such a terrific resource to have in Pima County, and the work that you're doing is amazing. So thank you for all of it, and for being such a great resource. So for the trainings that you offer in PDs, is there a fee for that for people to be able to access those, or does it depend?
All the cohorts are free. They're all free of charge. So they're virtual, and they meet approximately, and they run by semester. So this cohort now is January through May, and they meet about every 2 weeks virtually for 1 hour and free of charge.
Wonderful. That's great. Does anyone have any other questions for Leslie? Okay, well, we look forward to the September event for sure. All right, we have one more presentation, then we're going to get to some updates. So Caroline Lewis is going to talk to us about the community health assessment. Caroline?
Hi, everybody. So this will be really brief. It'll just take a few minutes, but I'm Caroline Lewis. I'm the Community Engagement Program Manager for the Pima County Health Department. I know I've met most of you either online or in person, and so I'm really happy to get a few minutes of your time to just talk about our community health assessment process and one specific aspect of this process, which is a survey that we are rolling out for Pima County residents. So you can go ahead and move to the next slide. Oh, that wasn't supposed to be there. Next slide. That also wasn't supposed to be there. Next slide. Next slide. Great. Okay, so for those of you who don't know, the Community Health Needs Assessment is a partnership between the Pima County Health Department, nonprofit hospitals, our community-based organizations and nonprofits and community members. And this is the process that really helps us to identify and prioritize health issues and priorities that the members of Pima County are facing. These can be things like food insecurity, the built environment, housing and transportation, those sorts of social determinants of health, or also things like non-communicable diseases like cancer and heart disease, substance use, and mental and behavioral health. So this is an assessment that happens every 3 years. The first one that we did was in 2011. And we use secondary data that we get from the census and county and state level data, as well as primary data through focus groups, key informant interviews. We do community forums. I will go ahead and put links in the chat after I'm done talking with the community health needs assessments from the past. But our last one was in 2021, which is the one that's pictured on the slide. You can go ahead and move to the next slide. So then once we do the community health needs assessment, we have a really good idea of what health outcomes are a priority for Pima County residents. But then what do we do with those health outcomes that we know are a priority? What work are we going to do within the community to really try to move the needle on these health outcomes? So this is where the Community Health Improvement Plan, or the CHIP, comes in at the health department. We love our acronyms. So like I mentioned, the CHIP uses the results of our needs assessment to really put in place strategies to address those health outcomes. So we have working groups for things like mental and behavioral health, substance use disorder, to really pull in members of the community who are already doing this great work to work on these issues in a more unified way. And so this is a way for the health department to really come in and, like I said, not duplicate work in these areas, but really support the work that's already happening in those areas and fill in gaps where we can as well. And so the 4 priorities listed on the slide are the ones that came from our 2021 to now process. So we're currently in the last year of our community health improvement plan for this cycle, but a lot of times these health priorities stay pretty much the same throughout cycles. Things like access to care and social determinants of health aren't going away as health priorities anytime soon, and we continue the work to improve those outcomes. Next slide. So like I mentioned, for the community health needs assessment process, we collect data in a few different ways. So we use data from the census, we use data from other needs assessments that are happening around the county, which there are many of, but we also collect some primary data using things like focus groups, key informant interviews. But this year we are conducting a survey as part of this data collection process. And so this is the first time, and I will put the link in the chat. I'm going to pop links in 1 second. So this is the first time that we've done a survey since 2015. So the goal of this survey is to really reach a representatively demographic group of Pima County residents, so that we're able to hear from folks what health outcomes are important to them and how we can make sure that we're prioritizing those in our community health improvement plan. So focus groups and key informant interviews are great, but they're not accessible to everybody, right? So we really wanted to make sure that people have accessible ways that are incentivized to give input on what health outcomes are important to them in their communities here in Pima County. So this survey is open from now until February 28th. I have the QR codes for the English and the Spanish version. I just posted the link to the website, which has some more information about what the needs assessment is, why it's important, and how you can share it. One thing I do want to mention is that this survey is incentivized. So for folks that complete the survey, which takes around 10 to 15 minutes to complete, I know some folks on the call have already done the survey and can probably testify that it's not too bad. But if you do complete the survey, you can be put into a raffle to win a $100 gift card. So that's a really cool part of this, is that participants have the chance to be incentivized for their work, because we like to value people's time. I'm putting one more link in the chat, and our communications team at Pima County has come up with some really great marketing materials to help push this survey out. So we have some social media materials, both in English and Spanish. We also have some flyers that can be printed out in English and Spanish with those QR codes on them. We have some videos that can be put on social media. And if anyone is interested in flyers or that sort of thing, like in terms of posters that you could hang up somewhere, I have copies of those as well and can facilitate that process. So why am I talking about this, and what can you do to help? Like I said, we really want to get as large of a number of responses from Pima County residents as possible. And I'm one person, right? So all of you are living in community, working in community, you're members of this community as well. So really trying to push out this survey with your contacts, the folks that you're working with and surveying, and within your personal networks as well. So all of you are more than welcome to take this survey. You could get $100 out of it. And I think those of us that are really entrenched in this work have often a really great perspective of what health outcomes are important, not only for maybe you, but the people that you're interacting with. So if anyone has any questions about the community health needs assessment process, or the survey specifically, I'm really happy to answer questions. I'll put my email in the chat, and I'll also put the links to our 2021 community health needs assessment and our 2022 to 2024 community health improvement plan. And I'll put my email in the chat as well. I think that's all I had, so thanks.
Thank you, Caroline. So it would be wonderful if everyone on the coalition could complete the survey, and then as Michael was saying in the chat, getting it out to your clients and folks that you know in your network would be wonderful as well.
And just to clarify too, because we have folks that work in school settings, don't get in trouble by surveying your students on campus. So that's a clear delineation.
Yes, don't do that.
Yes.
But encourage your teacher friends and the staff to do it. And to all the parents in your neighborhoods to have them do it, and anyone age 12 and older.
Great clarification. All right, so many of you may have already heard this update on the Jake's Law funding, but we wanted to bring this to everyone just to make sure everyone was aware of it. So Dan, I know you're on the call. Would you mind just giving us an update about the Jake's Law funding and where it stands? Thank you.
Absolutely. Yeah, so as a background, Jake's Law came out in 2020 as state legislation, and it was one-time funding at that time, and it was $8 million for the whole state. That was divided up between the three regional behavioral health authorities, the North, South, and Central. And it took really things to get going. It took through that whole year because you had to operationalize the funds, and then so with access with access figuring out how to operationalize it and account for the funding and all that kind of stuff, it really got going in 2021. And so as we and over the course of a couple of years, it's really helped a lot of kids. We've had more than 300, 400 kids per month being served, just from that funding source. I mean, it's been outstanding for everybody. And but what we got back in 2021 allocated to Southern Arizona was just a little bit over $3 million. And as you can see, if you have over this course of time, if you have month on month with 300, 400 kids on getting medical service, these behavioral health services, that you're going to use that $3 million up in a couple of years, and that's where we're at. So providers, we formed our school-based providers, and that the last day for accepting new members was yesterday. So, and then everybody who's an existing member, we're asking that they transition off those people to other funding sources through February and March. So they so yeah, it'll be, we're not kicking anybody off immediately or anything like that, but it's going to be, I mean, the last dollars will be probably out the door by the end of March. So we're just telling everyone at this point in time, don't add anybody more, but let's be careful with everybody who's existing. You got like 60 days to appropriately try to find something else. There's mental health block grant. There's the substance abuse block grant that's available, and you know, also they'll give some time to do access eligibility paperwork with the families to try to get the families onto access. So that's the instructions we're working with providers, and the providers have started already working with their members and going through that. They're you know, met with all of them. They expressed they have really great, you know, even the good success with getting kids those applications, those what we call non-Title 19 kids, those the kids that are not on access, but getting them to be onto the mental health block grant, which is a good option for a lot of these families that were previously on the Jake's Law funding. So we'll see how that goes, but just that's the status update for now.
Thank you so much. Does anyone have any questions? Okay, I know it was such a great pot of funding for our students, so hopefully we can get everyone shifted over to the other options that are available. All right. Next, we have an update from the Youth Health Action Team. And so I just wanted to take a minute and let you all know, after the last coalition meeting, the steering committee met with a number of youth-led groups that's in Pima County. We had a really great meeting to talk about how we can collaborate around this concept of the Youth Executive Board. And so we did move forward with the partnership with the Pima County Public Library's Youth Health Action Team. And so they have been very steadily working away to be able to get the Youth Executive Board up and launched. And so with that, Michael, I'm going to turn it over to you, I think, to give the update on the application process.
Yeah, and I'm going to defer over to Vico. Vico, do you feel comfortable talking about this, or would you like me to?
Yeah, I can go ahead and talk about it.
Wonderful, thank you.
Yeah, no problem. So as of today, the application for youth to join the Executive Youth Board has gone live. I'm trying to see if I can pull up the link so that we can put it
I can get that for you.
Okay, perfect.
Yeah.
And so this opportunity is available for teens over the age of 14 who are interested in being part of the Youth Health Action Team that is collaborative with Pima County Health Department and the public libraries. The opportunity goes up to age 24. We have 3 positions that we're trying to fill, which would be president, vice president, and secretary. And the youth who will be serving in these roles are going to be compensated through grant funds. So this is, you know, a great way for youth to further develop their leadership and also receive compensation for the work that they're doing. The application that just got put into the chat has a more thorough description of the time commitment that youth are expected to fulfill, as well as the exact term dates. I believe that the term will run until May 31st of this year, and so it's about 3.5 months. After that, there will be a break over summer, and the board will then again be revamped for the following fall semester. So yeah, we would love for you all to get this opportunity out to youth. I know that there was a question that I received from some PBHC members asking about the eligibility for undocumented youth. And that is something that I'm waiting to hear back from Michael about. That might be a little bit more complicated due to setting up student or youth as vendors through Pima County. But regardless, we also do know that the youth board will have general membership as well, and that would definitely be available to youth of any immigration status. And those youth will also be receiving different stipends and compensation for their participation and time.
Wonderful. And so the survey link is in the chat. And Vigo, I'm sorry, if you advance to the next slide, there was a little bit of information I put on there. I think you covered it all. Oh, maybe it's not the updated one. I'm sorry. Never mind.
It's okay. Yeah, so feel free to direct any questions about the executive board or the health action team to myself, Michael, or our librarians that I believe are also on this call. And we look forward to connecting with these youth and getting them engaged with the board or the committee. One of the responsibilities that they will have will be attending these monthly meetings. So you all will get to become very familiar with those youth and hopefully be able to hear more about their experiences and also support their development as leaders.
And Vigo sent out an email to the coalition with the details on this application. So if anyone didn't receive it, let us know and we can forward it to you, because obviously it's a very short window. So we need to get our youth on it and applying. Great. All right, so let's move
on. On that note, Raquel, just notice the timeline is that we'll have a youth executive board started before our next coalition meeting. So we'll need to have a dedicated spot for our youth executive board on the agenda.
There's so much happening between now and our next coalition meeting, which we're very excited about. Oh, and it closes on Valentine's Day. Yes, it is such a great Valentine's Day gift. All right, so the next update is about the Youth Mental Health Summit. We have a save the date for you. And Michael, I'm going to let you, are you going to cover this part as well? I think you wanted to talk about organizational sponsors.
I think Vigo's wings are all warmed up, so Vigo, take it away.
Go for it, Vigo.
They're just like throwing me into the sharks.
Yeah.
No, so
I'm used to just sending this all to Michael, but go ahead.
So yeah, a quick update on the Youth Mental Health Summit. We're super excited. We have our date set for Thursday, March 28th. The summit will run from about 8 a.m. to 4 p.m. We encourage everyone on the call to register for the event. I also wanted to share, we have a kind of like brief event schedule. Let me see if I can figure this out. That gives a rundown of what the day will look like.
You can zoom in, Vigo. Yeah, there you go.
There you go. So the event, as I mentioned, will start at 8 a.m. with check-ins and networking. 8:30 to 9, we'll have opening remarks. We're not super set on who will do those, but hopefully it will be Dr. Cullen. Then we will have a 90-minute presentation. We selected 2 different sub youth populations to focus the summit on, and that will be LGBTQ youth and helping them create a sense of connectedness in their school environments and classrooms. And the second population will be Indigenous and Native American youth and addressing behavioral health and mental health needs in that population. So the first presentation will go from 9 to 10:30. There will be a short break, and then the second presentation will focus on our Indigenous and Native American youth. There will be lunch that I believe is going to be sponsored again by Palo Verde Behavioral Health. And so will likely be catered again by Cafe a la carte. So if you all attended last year, that will be the same caterer. Then there will be a short 45-minute workshop info session that we're hoping will get to highlight the work of the consultant that will start working with PBHC. Hopefully they'll have some updates for the group by that point. And potentially an opportunity for us to ask questions and engage with that consultant. From 2:30 to 3:15, there will be a youth panel conversation. We're hoping that our youth executive board members and other health action team youth will be participating in that. And so I know that that was also part of last year, was a youth panel conversation. Then from 3:30 to 3:45 will be a brief recognitions and awards, and closing remarks will start around 3:45. So just like a brief summary of what the day will look like. Does anyone have any questions about that? Keep an eye out for an email that will include a link for registration. We're hoping to have that sent out by the beginning of next week. So I'll be sure to send it out to the coalition contact sheet that I have. And so, as Raquel mentioned, if anyone didn't receive that email with the executive board application, please let us know so that I can be sure to add you to our contact list and you can receive the save the date for the summit.
Wonderful. So March 28th, please mark your calendars for that summit. So the next update is on the strategic plan. And I just want to give a shout out to Michael, first of all, because they were able to, in record time, get the RFP out and through Pima County so that this could actually happen this year. And that is not an easy feat to accomplish. So I think, I'm not even sure of how quickly, Michael, you turned it around. But we did get the RFP for the strategic plan out. And Michael, do you want to give this update, or do you want me to give this update?
Yeah, I can give this update.
Okay.
So yeah, so it was record time, 2 or so weeks drafting process, and then 3 weeks solicitation. 2 days after solicitation closed, your steering committee all got together here at Abrams Public Health Building, and we spent about 4 hours evaluating 2 very good proposals. And I'm very pleased to share with you. So the RFP was for $40,000 to complete an array of deliverables for this coalition for strategic planning and organizational development. We can share more details about what they're going to be accomplishing, but until the contract is solidified, we can't tell you what consultant we have selected, but I can tell you they have vast experience. They take an equity-based lens, racial justice lens. They're going to serve this coalition very well. And so we do have confirmation from them that they're going through the process to accept. And so again, just out of privacy for them until we have a contract executed, we won't make that announcement. You know how these things work. So, but their anticipated start date on the project is February 12th. I think. So what we're going to ask from the coalition is this is going to involve a number of things: focus groups, feedback sessions with the coalition on these calls or in person, key informant interviews, right? Individual interviews, all sorts of things that are going to bring together a really successful process that has shared decision making and thought partnering. Okay. We want to make sure that all of our community is served. So that includes our coalition, but also the folks that are impacted, that we intend to be impacted by the work and the organizing and infrastructure building that we're doing. So that's all I'm going to share today. That's a major milestone for this coalition. And so by the end of this, by May, we will have a 3-year strategic plan, and we will know what our clear direction is, a mission statement, a vision statement, our coalition values, and I mean, it's just a major milestone. So we should all feel very proud. And thank you to the steering committee who scored those proposals yesterday, took 4 hours of their in-person time and helped make that selection so that we could, you know, experience this historical moment.
So it is our hope that we will have the strategic plan contractor at our next meeting. So along with the youth executive board. So hopefully everyone can make the next meeting because it's going to be great. There's going to be a lot to cover. All right, I realize, are a little bit over our time, but let's do a quick call to the audience to see if anybody has updates that they'd like to share. Kenneth, I noticed earlier shared an update on the annual mental health awareness walk, which I've seen a lot of advertising for, which is great in terms of how many times I've seen that. So Kenneth, if you want to add anything other than what you had put in the chat, please feel free to do so. And does anyone else have any other updates? Okay. Do we have anyone that is interested in doing the member spotlight? I'm going to say tentatively for the March coalition meeting. If not, then because it might be busy with all of the additional things going on, so it may be April. But who hasn't done the member spotlight yet that would like to?
Raquel, I think we talked about La Paloma doing a member's spotlight.
Okay, perfect. So we have somebody for the member spotlight already.
But whenever, they can do it whenever.
Okay. Michael, your hand is up, but you're on mute. Go
Yeah,
ahead.
really quick before I jump off. I just want, Vico, if you can put your email in the chat, we are going to need help to, just like last year, to pull off the Youth Mental Health Summit. So if you were on the planning group last year, of course, you're more than welcome to do it again this year. But if you are looking to get into the trenches with us and get this thing rolled out, more hands make for less work. So, please reach out to Vico if you're interested, and that will be like a sub working group with the coalition to make sure this thing is pulled off. Please help. LOL. All right, I'll see y'all later. Thank you so much.
Thank you. And Morgan, that's a great update on Teen Lifeline. Congratulations on finding the community liaison. All right, so our next meeting is going to be March. Vico, can you advance that next slide? Because I can't remember exactly. Oh, keep going, keep going. We're going to skip that. We're out of time. Oh, and I didn't even put, I'm so sorry. Our next meeting is going to be March 7th. And so again, if you all could make it, it's going to be a pretty big meeting in terms of the strategic plan and then the youth executive board. So we hope to see you all there. Thank you, everyone.